Hi, my name is Rob Brantley, kinesiology student at Cal Baptist University. I have here my volunteer assistant, Marissa Pichet. We're going to help demonstrate a few rehabilitative exercises you can do if you sustained a sprained ankle. Equipment we have a TheraBand, we have a Bosu ball, and we'll go ahead and take you through a few exercises here that will help you rehabilitate that injured ankle. So our first set of exercises we're going to do with the aid of resistance TheraBand. We're going to go ahead and wrap this and tie it securely around your foot because we don't want this coming back and snapping you or me. All right, so for our first exercise, we are going to take Marissa through resistance in plantar flexion, or taking the foot from a 90 degrees angle and pointing your toe as far as you can, almost as if you were pressing the brake on the pedal of a car. And making sure that the resistance band is secure. She's going to apply resistance in plantar flexion. There she goes as she moves her foot down as if she's pressing the pedal, the brake pedal of a car. All right. After she's performed about 10 repetitions in plantar flexion, you can work the antagonist or opposite side, opposite muscles that perform the opposite action, resistance in dorsiflexion, which you can perform this exercise by thinking about taking your toes and trying to bring them to your shin against resistance. So here, the concentric portion of the movement occurs during dorsiflexion, and the eccentric is happening while she brings it back to plantar flexion. Again, working the opposite muscles of the ankle through the sagittal plane. And again, she'll perform this at about 10 repetitions, after which you can move on to exercises that could help strengthen the muscles that aid in moving the foot through the transverse plane. So in the event that your TheraBand breaks, it's good to have a spare on hand. So again, we're going to securely tie the resistance TheraBand to the foot around the arch of the foot. And this time we're going to apply resistance to the medial side of the foot. Our patient Marissa is going to try and evert or rotate her foot laterally, which would be the concentric part of the movement, working the muscles that assist in eversion, performing this at about 10 repetitions. And after that's complete, again, adversely, we can work the antagonist muscles that work inversion as she turns her foot towards the midline of the body. This works the muscles that aid in inversion. And after about 10 repetitions of that, she's completed exercises in all 4 planes of motion, which help create balance back in the muscles that surround the ankle. This helps strengthen and stabilize the ankle as she progresses through her rehabilitation. And as she progresses, the amount of sets, reps, or resistance can increase, but from the beginning, we'll probably start her off at about 10 repetitions, 2 to 3 sets, 2 to 3 times per week, just depending on how her ankle is recovering. All right, so next we're gonna move on to some Bosu ball exercises. Okay, in this second part of the rehabilitative exercises, we're gonna demonstrate some exercises we can do on a Bosu ball. Now the Bosu ball is great because it kind of adds an unstable surface for the patient Marissa to get some exercises on. This is going to help the patient reestablish that neuromuscular connection and the proprioception that might have been lost during the stages of rehab when she was immobile and not moving. So we're going to go ahead, and usually in the earlier stages of a sprained ankle, the patient might not be able to bear as much weight, so you can start seated while performing these exercises. So we're going to go ahead and demonstrate them seated first as she works through the 4 planes of motion. As you can see, she's going to begin to plantar flex there. Maintaining balance on the Bosu ball, she can work it all the way back to dorsiflexion, bringing it back to the middle, and now she can work inversion of the ankle, and then go ahead and work that all the way back to eversion of the ankle. And she can go ahead as you can perform those 4. She can perform each at about 10 repetitions, balancing on the Bosu ball. In the earlier stages, she can start out at about 2 sets, and kind of depending on her progression and strength of the ankle, she can increase the amount of sets to 3, 4 sets. And again, as she progresses and her ankle starts becoming stronger, she can do this standing and balancing on the Bosu ball. Recommended that she perform these exercises in between 2 to 4 times during the week. This will allow her to have some days of recovery as the muscle strengthens, and also keeps her from over-aggressively training the ankle, which will help in not re-injuring the ankle or extending the rehabilitative process. But yeah, this has been a couple exercises that you can do to help rehab a sprained ankle. Thank you, Marissa, for being my volunteer and demonstrating. All right, thank you.